Hello, everyone. Welcome to another section with Dental Shadowers. And today we're really fortunate to have Dr. Wu with us. And Dr. Wu, thank you so much for taking your time out of your days to have this talk with us. And you can take it away whenever you want.
Yeah, so first of all, thank you for all in the group for attending. I know it's an unprecedented time. Going back to when I was a young college student applying to dental school, it was easy to shadow, and I know during this time it's very difficult. So I try to put these slides together to kind of give you guys a sense of what I do every day, and I have some tips, obviously, for those of you who are looking to apply to dental school. And again, my heart goes out to you guys that you can't do this the way that I was able to do. Um, a little bit about myself, my journey to becoming a general dentist. I actually had dentistry as the furthest away from my mind. I actually had a bachelor's in finance at University of Illinois. My journey to dentistry was actually by accident. In my third year of college at University of Illinois, my really close friend in college, his dad was a dentist, and all he ever did was talk about dentistry. Well, long story short, he talked about it so much that it got me to start thinking about it. And I even worked as a dental assistant to kind of see if there was something that I wanted to do, and which is what I recommend for all of you if you have that opportunity, because then you can really immerse yourself. Well, my good friend, his dad, kind of encouraged me to apply. I did, and regardless of my major, he told me a little bit about his history. He was actually an art history major, and he kind of fell into dentistry by accident as well. So for all those of you who are not biology majors, it doesn't mean it's too late. You always have that opportunity. I applied to Tufts. I took a gap year to kind of study, get all the DAT requirements, and I got accepted to Tufts, where I'm originally from in the Boston area. And after I finished my dental school, I did HD residency at UCLA. For those of you who don't know what that is, it's an advanced education in general dentistry residency program. After my residency, I practiced for 3 years as an associate in several different locations. And for those of you who do make it through dental school, I highly recommend that. Working in different practices gives you a different outlook of what kind of dentist you want to be and what kind of practice you want to run. Much like if you go to a restaurant, there's fast food chains, there's high-end restaurants. Same thing with dental practices. There's so many different types of dental practices. So you got to ask yourself, what kind of dental practice do you want to be part of? And that allowed me to kind of define the brand and what I wanted to be. After 3 years, I actually I purchased the practice Emerson Dental. It's a multi-specialty practice in Westford. I worked there as an associate for 2 years, and the previous owner just wanted to finish up. My practice grew. In 2019, we opened up a second location. A little bit about my practice is we are a fully digital office with CEREC CAD/CAM technology, and I'll talk about that a little bit later here in this presentation. And I also, because I had to start managing the business, I'm a graduate of Henry Schein's Dental Business Institute, and I was also featured in Dental Town's magazine on the business side of dentistry. Now, I still see patients. I'm not just the owner. I have 6 other dentists that work with me, myself, 2 other general dentists, an endodontist, a pediatric dentist, and a periodontist. So that's why we are a multi-specialty practice. Now, I've kind of narrowed my practice into just mainly restorative and cosmetic dentistry, and those are mainly the cases that I'll show you. So advice for pre-dental students. Obviously, the most obvious one is you should all join a pre-dental club, get like-minded people to work together. You guys are all gonna pick each other's brain on when you should apply, what schools you apply, and it also gives you an idea of if you're missing something. I recommend taking the DAT early. If you take the DAT early, if you don't get a great score, you can take it again. And obviously, if you get the scores you want, you have the grades, definitely apply early. I know the shadowing right now during this time is very difficult, but if you can, I highly recommend that too. And then visit dental schools. Many dental schools will allow you to come and visit so that you can see what the day in the life of a dental student is. And also a very important thing, I know a lot of you guys are going to get into the nitty gritty of like what tools do what, what do these materials do, but just remember there's a human being attached to these teeth, and this is a people business. So your ability to deal with people of all kinds of nature and backgrounds is very important in this business. I found that many of the dentists that are very successful have a very strong sense of customer service and know how to deal with all sorts of different kinds of people. It's not always the smartest kid in your class that does well as a dentist. So obviously the question is, what's general dentistry? Typically, we are the first point of contact for patients to see. And a general dentist kind of can do everything. Now, I highlighted in red what typical general dentists will do in their practice. Some general dentists will do their own endodontics, which is root canals. Some will refer that out to a specialist. Some will do some extractions and some periodontal procedures. Again, some might just refer that out. And then pediatric dentistry, some general dentists will see kids, some won't. And then for those, many of you probably had braces, and some general dentists will do Invisalign or some sort of orthodontics, and some won't. And then we cut to prosthodontics. That's where we're talking about crowns, bridges, dentures. Some dentists will do that, and some will refer them out. The main thing that the general dentist is, they're the first they're usually the first dentist that you see, and they'll take care of treatment planning things. If you have cavities, they'll fill them with simple restoratives. Those don't get referred out to a specialist. That's kind of the general dentist specialty, if you ask me. Now, below, you'll see some different specialties. There's 12 specialties in dentistry, 12 recognized specialties: oral maxillofacial surgery, radiology, pathology, oral facial pain, oral medicine, and dental anesthesiology and dental public health. Again, I highlighted the red because that's typically what most general dentists will do. They typically
Sorry
don't.
to interrupt, but we only see the first slide.
Oh, you do? Okay.
Yeah, we always see the first slide. Let's see.
Can you see this now?
Oh, yes, we can see that now.
So you didn't see my other slides?
Yeah, we can see other slides. Okay, yeah, I think now we're on.
Well, hold on. Screen shared is paused. Please bring you. Can you see this? No?
No.
Okay.
Let's see.
I'm not sure. Okay, let me try this again.
Okay.
Can you? Is this okay if I just do this? Because
yeah, I think so.
For some
we can
reason,
just maximize it, and then I will minimize it.
Okay, can you see that now? Okay. So sorry. I'm back now. Okay, can you see all this now?
Yeah, but then there's like a black box on the right-hand side.
Okay. I am not super tech savvy with this stuff, so you may have to bear with me here.
Oh yeah, that's a zoom. Let's see. Yeah. Okay. Yeah, I think I minimize that.
Minimize this?
Like the zoom on
Is this better?
Right. Yeah, I think this is better. Maybe we can just do this.
Okay, sorry. Let's see. Let me fit the slide. Oh, this Zoom. Let me go to, that's not, fit the slide. Okay.
Yeah, I think this is great. We can still see it.
Okay.
Okay.
So I'll just do it this way. Is that okay?
Yeah. Yeah. Okay.
Okay. So I apologize for that. Again, a little bit about myself. Do you want me to start back here or no?
I'm sure. Just like
I said, just going back, I know this is being live. Here's the slide about myself. Like I said, I started off as a finance major, and long story short, I wasn't the end of my journey. I switched careers and I went into dentistry. And, like I said, I purchased my office in 2010. And, it is a multi-specialty practice. And as we spoke, I have periodontics, pediatric dentistry, endodontist, and two other general dentists that work with me. Now, we didn't start that way. It was a very small office and it just kind of grew into that. I'll talk a little bit later about what CEREC is and what a fully digital office looks like. And, I've been featured in some dental magazines about the business side of dentistry and how I kind of operate things. As I said earlier about advice, take this for the slide. I'm not going to repeat it just for interest of time. I left some time at the end so that, there was questions. I didn't realize this was all live, but, hopefully that if people want, they can always message me. I'm happy to answer questions. And as I was speaking earlier, these are the 12 recognized specialties in general dentistry, or in dentistry. These are the 12 recognized specialties. Most general dentists prefer the ones I see in red. They might not do every single one of them. They'll refer some of the more difficult cases out to specialists, but most general dentists are kind of, they'll tackle the easier cases. And in my office, because we're multi-specialty, I actually refer all the root canals, all the perio, and all the pediatrics to my specialists. I do some minor Invisalign and orthodontics. And I do, because of my advanced education in general dentistry training, and my director was a prosthodontist, I'm very comfortable with some of these large prosthodontic cases. So I do those in my office. Again, the lower specialties are typically ones that are in an academic setting. We do refer as general dentists to these specialties, especially when we are not as well trained in these fields, we'll actually refer to them. I use this schedule as kind of what a typical day is. I kind of just took a screenshot. If you look on the right, you can see that's my hygiene column. I have 3 hygienists. And so for those of you who have ever been to a dentist, you probably wonder, when you get your teeth clean, you see the dentist for about 5-10 minutes. Part of the reason is because he's working out of multiple chairs, and he is multitasking. That's actually the important thing to understand. So, general dentistry is really meant for someone who can multitask. If you're not a multitasker, you are not going to enjoy it. Most specialists don't love multitasking, which is why they specialize, so that they focus on that patient and they don't actually leave the chair as often. Here's another schedule. You can see that schedule in orange. That's my surgeon. That's his typical schedule. And you can see that he doesn't bounce other ways outside of the schedule. I bounce out to check all the hygiene, and then we have consults on the side. What kind of complaints do patients present with? Well, because we're multi-specialty, these are the typical complaints that patients will present with. Gum disease, mouth sores, cavities, oral cancers. And what that means doesn't mean a patient comes to me and says they have oral cancer. They'll sometimes have a weird bump that they're not sure of. It could just be trauma. The most common ones are obviously toothaches and dental emergencies. Tooth sensitivity, bad breath is a common one, tooth erosion. And for patients, especially during this pandemic time, we find a lot of them have TMJ issues due to grinding through stress and many of those things. Now, what kind of procedures, like I spoke earlier, root canals, periodontics, pediatrics, all these are what general dentists do perform. Again, it depends on the general dentist training, their comfort level, and school doesn't end when you finish dental school. We are required to take continuing education courses, and that's really where the dentist will expand their knowledge. I know a lot of general dentists that do a lot of root canals because they enjoy it, and so they take a lot of continuing education courses. I know a lot of general dentists that see a lot of kids because they enjoy it. So it really kind of, general dentistry is kind of what you can kind of carve your own path. And if you truly love one specialty more than the other, that's when you actually decide to specialize. And, that would require, at least a minimum of 2 to 3 years of residency training. Diagnostic instruments that I use. This is just a basic setup in my office. Obviously we'll take x-rays, CBCT, which is a cone beam 3D x-ray if we're not sure about something, obviously with our eyes, visual. As you can see, there's a mirror, explorer, and a periodontal probe. There's something called endo ice where we cold test. If a patient's having sensitivity, We'll use that to test to make sure we're actually treating the right tooth. Bite stick to see if a patient's having trouble biting on a tooth. We'll use that. And the bottom line is we want to measure twice and cut once. So we want to make sure that we're identifying the right tooth. Now, many of you know, and I know there's been other lectures about what new technologies been in dentistry. One of the more recent ones is obviously cone beam technology. It allows us to take a 3D X-ray of a patient's mouth. Normally, when you take an X-ray, it's a two-dimensional picture of a three-dimensional object. And so, as many of you know, there are angles and things that you just cannot see. The 3D technology has actually been a game changer. It allows us to better equip to see where patients are candidates for implants. If there's root canals that have areas where we can look for missed canals, and also allows us to see if the patient is high risk for pathology, or if there's something that we just cannot see normally out on the 2D X-ray. Now, this is where the oral maxillofacial radiologist comes into play, because most general dentists aren't trained to read the read this in depth. So, at least in my practice, I always I always refer this out to a radiologist to help me identify pathology or anything that I might miss. Now, I can see the obvious things, but I always send it out just to make sure that there isn't something that I need to like follow up on with the patient, especially when it comes to oral cancer and pathology. Something else that's new is 3D printing. CAD/CAM technology is here to stay. We can now 3D print models instead of the old style stone models. It's actually very cool. For those of you who 3D print toys, it's actually very similar. Just our printers are a little bit more robust and a little bit more accurate for what we need to do in dentistry. So many of you may ask, what is CEREC? If you don't know, it's digital dentistry with same-day crowns. It actually is not 3D printed crown, it's 3D milled. And you know, about 5 years ago, my office actually integrated it into the practice. And I have a video from Sirona, which is this company that makes CEREC. They documented my journey with it. So I'm going to play this video so you guys can get an idea of what CEREC is and you know, my journey with it. We're going to get you nice and numb and comfortable here. This will be your last, hopefully your last crown that you'll have done with traditional goopy impression material. You know, a lot of doctors will sympathize with me when they say that when they're biting in that impression, you're sitting there crossing your fingers and praying that, you know, you get all the margins and everything that's in there. So we're looking forward to be able to instantaneously know if when we scan, if we got the margins correctly or not. No air bubbles. Now Sarah's prepping the impression material that we took, the pre-impression material. She's going to start that temporary crown here. You know, in 3 weeks we'll have your permanent crown here. Like I said, next time we see you, we won't need to have to do this. We'll see you in 3 weeks, okay?
Right this way, Maria. Thank you very much.
Hi, Kim. Yeah. How you doing?
Good, how are you? How are you?
Good, how are you?
Good.
So today you'll leave with the crown in one visit. So different than last time, you know, when we had to take impressions and everything. Today we're actually going to scan your teeth in a computer.
One day.
One day.
One day.
And you'll get to see the whole process today. Just got training this weekend, and I brought the whole entire staff. Monday we had actually our first 3 patients. They're having a lot of fun, and you know, I think we were all nervous about how the transition was going to be, but it's been very smooth.
What I'm going to do is cut out your tooth and what it used to look like, and we're going to rescan. So we're going to go ahead and cut that out.
For Maria, we're going to do a zirconia crown here. So open lab coat here. This is our second zirconia crown here in the office, so you get to kind of see it. All right, and Dawn's gonna start designing your crown here, and we'll get it ready to mill, and you'll get to see it.
So he just scanned it back in, so now the computer is forming all of these scans together. so they can articulate your bite, make sure you have enough distance in between to have the crown actually seat all the way instead of putting you through all those goopy impressions again. So this is your block here.
Dawn's gonna put it in, we can actually watch it do its thing.
So we're gonna take our block and place it in here.
Yep, that's gonna be your tooth.
So it's doing like the top, like the crevices. And
Yeah, no, a lot of patients have been actually taking videos of their teeth, and
saves time, money, and everything
this is
else.
exactly how I thought of it too. It's like the initial investment, but now it's gonna save time, not just my time, but the patient's time.
Kind of cool.
All right, so green means go. We're ready.
Yeah. Okay, Kim, your crown's all done. We're gonna try it in and get it finalized for you.
Oh, wow. Pearly white.
Yeah.
Looks beautiful. Crown here.
lovely.
Look at how beautiful it is.
It is.
All right, I'm gonna have Dawn take an x-ray. We're gonna make sure that it fits the way we want it to. All right, so if you wanna come around here, John. So here's the x-ray of number 2. This is my 5th CEREC crown since training. I'm actually very happy with it, and you know, the training was great and things have been very smooth. I will admit that I was very nervous at the whole transition of going from analog to digital, but the transition's actually been a lot smoother than I anticipated, so I wanted to share that with all of you. Let's get ready to cement this here. All right. Joy, I just want to make sure you could hear the sound on that video.
Actually, we didn't hear it.
Oh, you couldn't hear the sound.
We couldn't hear the sound.
Oh, I'm sorry. I
That's
wish you
your
had said
sound.
something. So
Oh,
I can send the video at some point. Again, like I said, I'm not the most tech savvy here, so
yeah.
I'm not sure why it didn't. play the
Yes,
sound.
I didn't want to bother to like keep making you, yeah. But I
No,
think it'll be okay.
But again, well, you know what? Here, let me try this again. I'm just gonna play this again. Let me just see, because I think it will. Let me see if I can get this up. Share sound. Okay. We're gonna get you nice and can you hear this now? This will be
Oh yeah.
okay, let me play it just so that everybody can with traditional
Okay.
impression material.
But we can't really see the screen. There's nothing.
Oh, you can't
showing.
see the screen. No, a lot of
Yeah, the video.
doctors will- Okay, let me try this again. I apologize. This is
Okay.
okay. We're gonna get you nice and numb and comfortable
Okay.
here. This will be your last, hopefully your last crown that you'll have done with traditional goopy impression material. You can hear that, Joy?
Yeah.
You know, a lot of doctors will sympathize with me when I say that when they're biting in that impression, you're sitting there crossing your fingers and praying that, you know, you get all the margins and everything that's in there. So we're looking forward to be able to instantaneously know if when we scan, if we got the margins correctly or not. No air bubbles. Now Sarah's prepping the impression material that we took, the pre-impression material. She's going to start that temporary crown here. You know, in 3 weeks we'll have your permanent crown here. Like I said, next time we see you, we won't need to have to do this. We'll see you in 3 weeks, okay?
Right this way, Maria.
Hi, Kim. How you doing?
How are you?
Good, how are you?
Good.
So today you'll leave with the crown in one
Actually, I
visit.
think everyone
So
heard
different
it.
than last time. You know, we had to take impressions and everything.
Yeah, I think it's because I'm monitoring. That's why I can't hear it. But
Okay,
in the
I'm
chat,
sorry
we
about
heard
that.
it.
Okay,
Yeah, I'm
that's
so sorry.
It's okay. So let me just keep going. I apologize for all
Yeah.
the technical difficulties.
Thank you
You
so
know,
much.
computers are not my strong suit, and I just bought a new laptop, so I apologize to the group. I'm still figuring out how all the buttons work here, but
No, you're good. You're good.
some important terms in
Thank you.
dentistry. These are terms that we use to communicate with each other. As you can see on the left screen there, we talk about, just like if you were going to have a roadmap, what location where cavities are, we'll call it, it's on the cervical, is it on the occlusal, is it on the buccal, is it on the lingual? And actually, if you ever, for those of you who haven't worked in an office, that's actually how we communicate, what surfaces the cavities are on and what tooth number. If you don't know, we number teeth from number 1 to the upper right wisdom tooth all the way through to 16. And then when we go to the lower, we'll go 17 through 32. So you'll often hear in a dental office, if a dentist is charting teeth, he'll say, number 3 has a MOD composite or an MOD amalgam or DO amalgam. That's me telling my assistant or another dentist what surfaces the restoration is at, and or what surfaces the cavity is at. So that is actually how we communicate with each other. And these are important terms in dentistry that you will learn in dental school. You don't need to know this before you even apply to dental school, but I think it's helpful to know what, dentists communicate with each other, especially if you're going to shadow, because you'll hear these terms used very often. As you can also see, this is how we chart. I think, I'm a digital office, so we actually chart digitally, but if you look online, you'll see paper charts, and you can see that it's really exactly what I said. We chart things on MOD, DO, what surfaces they are at, so that we can get an accurate chart. And the reason why it's important is because, every person's mouth is different and their dental chart is different. And sometimes, unfortunately, they'll use the dental chart to identify, the deceased, if they cannot identify the person who did decease. And unfortunately, I'm sad to say that I had been called by the coroner's office to do so, where they'll check charting because they'll use dental records to verify the person is who they are. Some of the other things of new technology, and I'm going to go over cases again. For those of you who love surgery, I don't have those to present to you because I've actually kind of funneled my my specialty into mainly doing orthodontics and restorative. So I have 2 cases I'm going to show you. One is an Invisalign case. Many of you probably know it's invisible braces. And here's a patient from before and after that, they really didn't like the way their smile was, and they didn't like how much crowding. And this is a case that took me about 12 months. And you can see the before and after. These are the kind of cases that, as a general dentist, I'm comfortable tackling. This was a fairly easy case. Also, patient compliance was huge. There are some patients that I will refer out for orthodontics, mainly if they have skeletal issues where their bite is really off, or if they're missing teeth, or if we're making space for implants, or anything that's a little bit more complex. This is another case where, although you may not see it, this patient was not happy with, and you can see probably on the arrow here, this lateral tooth. They didn't like how this lateral tooth was the same size, wasn't the same size as the adjacent tooth. So they had asked me, can I just put a veneer on? Unfortunately, as you can probably see up here, there wasn't a lot of space. I can't magically make this tooth bigger. So with this patient, we actually orthodontically moved teeth to create space, as you can see here. And so we created the space so that we can then bond or add a veneer there. So the after picture is here. You can see after we created the space here, we actually bonded a veneer so that the 2 laterals will have a little bit more similar size shape. Now, originally, when we planned all this out, she actually thought about doing 6 veneers and trying to changing and transforming her smile, but she decided that she was actually happy with just having that 1 tooth done. So we didn't pursue anything more than that. But this is a perfect case of communication with a patient throughout the whole process was important. It's less so the dentistry, having that back and forth communication on what is it that you're looking for, because beauty is in the eye of the beholder. What I thought would look better wasn't what she was looking for. I actually think that her smile was fine before, But she really just wanted to have those two laterals, and it bothered her enough that she wanted to do something about it. Now, we talked about digital workflow, crowns and the CEREC. This is a friend of mine. He's a pediatric dentist. He also sees me as a patient. He actually broke his tooth, number 3, like we talked about. And you can see he's got a big silver filling here. A friend of mine did the root canal for him because he was having pain on biting. And so typically after root canal teeth, the teeth become a little bit more brittle. And as a result, because they're more brittle, we typically crown the teeth. So I'm going to walk you through some pictures that I documented on his case on when we did his crown. And you can see here, we prepared his tooth. If you think of a crown, it's like a helmet for your tooth. We have to make the tooth a little smaller. So we're going to cover the tooth so that the patient can't crack the tooth. And here you can see, we typically, when we make a crown, we're going to want about 1 millimeter to 1.5 millimeters of thickness. This was all done in one day, as we talked about the CEREC video that I showed you. We actually digitally scanned his tooth. And then you'll hear dentists often talk about margins. Margins is where the crown meets the tooth. And you can see the blue line that we draw in. And so there's my assistant and I were scanning him. And you can see that, we scan so that we can actually have a full model to work on his teeth, because you can't do it in his mouth because the porcelain that you make actually has to be baked in an oven. So, okay, and here he is. He wanted to document everything, so we actually digitally designed his margin. We checked the proposal. There's my lab technician. Obviously, nobody's wearing masks because this is all pre-pandemic when everybody was masked up. And then this is his final design. We actually milled out his crown, and you can see it's right there. That's this final crown, and we took a picture. And when we mill out the CEREC, it comes out in a purple stage. It's uncrystallized. And for those of you who are wondering, it's lithium disilicate is the material we use. It's called EMAX. And we'll crystallize it in the oven. It usually takes about 15 minutes. So that's why the crown visits typically take about 2 hours here. It usually takes me about, 10 to 15 minutes to get the patient numb, prepare the tooth. It usually takes us another 15 minutes to, design, another 15 to 20 minutes to mill it out, and another 30 minutes to put it in the oven. And then at the very end, we'll cement it. Most dentists like myself will take a X-ray to make sure that it's fitting properly. And you can see the X-ray below is kind of a 2-year post-op. We always want to make sure there's no leakage. When we take X-rays in dentistry, we're always looking for dark areas. So we can see there's a nice margin and a nice seal. Why you see a dark spot here is because we haven't cemented it yet. Once we cement it, you see that kind of like nice white line there. So I apologize for a lot of the technical difficulties. I actually thought there was going to be Q&A here, so I left some time at the end. But my advice for future dentists is smart people learn from everything from everyone. Average people learn from their experiences, and stupid people have all the answers. Please ask questions. It's a journey. I remember when I was in your shoes, it was difficult to find shadowers. There are people out there. That's why I look at this as giving back. I do have an Instagram page. Feel free to message me. I hope you enjoy this. Again, I left time at the end to answer questions, but I know this isn't fully live. You're welcome to message me on my Instagram. That's a great way for me to interact and talk a little bit about, and good luck to everybody on their journey to dental school. I have no regrets on my journey.
Mhm. Okay. Yeah, we do have some questions from the live chat. So our
Sure.
first question is, how did you train to become a dental assistant? How long was the course? Was it difficult to find a dentist to work for as a dental assistant?
So, sorry. Yes. I lucked out in Illinois because there was actually a very shortage of dental assistants. And also the dentist that I worked with, he was willing to train me from scratch. I think at least in the state of Massachusetts, you're required to be licensed now. So I will say that it's a little bit more difficult depending on your state. Even if you can't work as a dental assistant, even if you can work to help answer phones, just being in the office will help because you can actually just have all of that experience. Again, different time, different era. When I was applying, there was a lot more on-the-job trained dental assistants than there is now. Now there's a lot more formally trained because they go to dental assisting schools. But I would still reach out, dental schools, dentists, even if you can even ask them, like, can I work, just answering phones for you or something simple. Just being around the environment will help you.
Okay. Our next question is, what is the success rates of the machine and how comfortable are you using it?
I use
So-
CEREC for almost all my patients. I would say it's like a 99% success rate. I have very few redos. I've been doing it for about 5 years now. And really, that's, I wouldn't have integrated it otherwise. My clientele, we talked earlier about like dental offices being like restaurants. There's high-end restaurants, there's fast food restaurants. My dental practice is my demographic for my practices tend to be a little bit more high-end clientele, and they typically will not tolerate failures. So I wouldn't have integrated this if it had a high failure rate. So great question.
Okay, got it. And our next question is, when do we use zirconia versus porcelain?
Oh, yes. So for patients that are very heavy grinders, or if I feel like there's not enough room, I'll use zirconia, which for those of you who don't know what that is, it's a metal-based tooth colored material. I personally like Emax. It bonds better. It's more aesthetic. And really, for me, I usually only use zirconia for like second molars. Otherwise, for the rest of the teeth, I'll usually use Emax. It's just prettier. It bonds well, and I just get a better result.
Mhm. Our next question is, how was the space created in the second ortho case in the maxilla?
Right. So that second case, and I'll just go back to it so that we can talk about it.
Yes.
We're probably talking about this case. This was actually a little bit of we retreated. We IPR'd the lower, and we expanded the upper a little bit just to create. I really needed to create almost like barely any space. I mean, IPR, for those of you, it's called interproximal reduction, where we use a strip. It looks like sandpaper, and you basically create tenths of a millimeter on the teeth. It took about 8 months to create that space. And because I'm the one who's doing the orthodontics and the restorative, it was easy for me to control because I knew how much space I needed.
Okay. So, and someone also asked, on the scan, what does the blue and green parts on the tooth highlight? So
This part, right?
yeah.
The blue and green.
Solid.
So it's kind of topography. The blue, it goes from blue to red. So blue, teal, green, yellow, and then red. It lets us know how heavy it's touching to another tooth. Or in this case, when we see this little part, this is how it's touching adjacent to another tooth. This is where the bite is. So you have to remember, when we're building a tooth, we have to build it to the bite, like you can see here. So if we make this super tall, then the patient's going to say, oh, the bite doesn't feel right. So a lot of this is the digital technology letting us know in reference point to how high a tooth is, how small it is. And, if this is a back tooth, but we're making a front tooth, someone might say they want a tooth to look a certain way.
Okay. What are some of the best and most challenging things about dentistry?
I think the best thing is always making the patient smile, both figuratively and literally. You got to remember that, most people don't love going to the dentist. They're usually scared. And so the best challenge is actually turning that patient that's very phobic, that doesn't want to do dentistry, and making them your lifelong patient and building relationships with them. Getting them to smile. Again, not every patient's going to come in and say, I want a new smile, but just even getting them to crack a smile is huge.
Mhm. Then, what are some like challenging things about dentistry?
Again, going back to the phobia, dentistry has a bad rap.
That's
People don't want root canals. People, don't want to do it.
mm,
They don't like needles. It's painful. There's surgery involved, and honestly, for a lot of people too, it costs a lot of money. So they're hesitant to do that. So, this is why I said early on in the presentation that it's a people business. Your ability to deal with people is going to be your biggest factor in how successful you are.
mhm,
People don't know how much, people don't care how much you know until you show them how much you care. So
yeah. And what do you think like what skills and personality traits are most needed to excel in this field?
well, you gotta like working with your hands, right? That's an obvious one.
Yeah.
And then obviously you have to like people. If you don't like people, you're probably not going to be happy doing dentistry. That's just the reality of it. So, I think those are the two biggest skills. Everything else, dental school will train you for, even the hand skills. Then you're going to go through a lot of practices and stuff with that. So,
Mhm. And what do you wish you had known about this field before you entered it?
I had wished that I had realized how difficult managing the business side was. I even have a business background, and I can share with you that the dentistry actually became easy. It was actually managing the business, the staffing, and all those things that became very difficult. And I wish I had more experience and more knowledge about that.
Mhm. Yeah, I think the dentist I shadow also said the same thing.
Yeah,
And so do you recommend people like take some business classes
I
during their
can't hurt.
undergrad or
I think it's interesting. I think that take some business classes, watch how people run their businesses. I think it's always interesting to see those things.
Mhm. Um, and our next question is, how has COVID-19 affected your practice considering the high risk of transmission in this field?
It has. COVID-19's actually impacted my business very negatively, unfortunately, because my demographic was very cautious with everything. So our business slowed down tremendously. I also found that more patients waited to do things because of that. And unfortunately, I used to have a lot of young high school students, college students come in shadow, and I unfortunately had to say no because I had to do what's best for my patients and their comfort level. And having someone shadow was not in their comfort level. Also, it's hard to communicate with people when you're always wearing a mask, and that's what we're doing. So they can't see your smile, they can't see, they can only hear your voice, and they can just see your eyes. So the other part is just protocols and all those things. I mean, it's been wearing. I will say this. I commend all of you for wanting to apply to dental school still, because I don't know if I would do it with this COVID-19, because the amount of PPE that we have to wear is, borderline crazy. But I mean, obviously, we're doing it for the safety of all.
Mhm. Okay. And then someone asks, when etching, do you prefer total etch or self etch?
I
And
prefer
does
total edge. I prefer
yeah,
total edge. Yeah.
okay.
Again, personal
Eh,
preference. I didn't get into the nitty gritty of how I do every little technique because, in many ways, dentistry, it's like cooking. Everybody has their methods. They have their style and their techniques. At the end, it's like baking a cake. Some people use different ingredients and everything, but at the end you have a cake. So same thing. It's like the end result is more important than all the different techniques, because when you go through dental school, you're going to learn a whole bunch of different techniques, materials, and everything. So you're going to find what works best for you.
mhm. Um, and also ask, does total etch form a better bond?
I believe it does. And again, I'm not the big science guy, so those will be better questions for somebody who's really into like dental materials and the biomechanics. I'm going to defer that question because, again, I'm a dentist by trade, but again, like I said, I've narrowed my my practice into more, restorative and the cosmetic stuff. I always try to keep up to date with the latest technologies, but technology is ever changing. So, I might say one thing to you today and there's something new will come out because research will come out and say, this is a better bond. So
Yeah.
I try to stay with what's true and works, because I try to not change what already works, because again, I'm treating live patients. I don't really want to experiment on them. So, that's actually something important. I really I'm not always the first person to adopt something. I usually wait to hear from other dentists that try things. I'm like, oh, how did that work for you? Okay, then I'll look into like implementing it, because I am not the first dentist that implemented CEREC. There were plenty of other dentists that did it. Sirona just decided to document my journey, because I was like, oh, let's show my journey of how the transition was.
Okay, that's great. And our last question is, how does your career affect your lifestyle?
One of the things that I love about dentistry, I will say, is that it allows me to make my own schedule, especially because I own my own office, and I have a lot more freedom with my family. My schedule is Monday through Thursday. I work 8 to 5, and I spend Fridays off doing the things I want to do, and weekends with my family. Now, I didn't start that way. I will paint the picture. I had to work my way there, but that was always my goal.
Okay. I think that's all the questions we have today for
Okay.
you.
Well, I thank everybody. Stay safe out there, and I know this is an unprecedented time, and I empathize for all you that are applying to dental schools. It's not an easy time. So
actually, we have one last question.
okay, sure.
So someone asked, would it be better to work for a private office so that we will avoid the business side and have more say in our work, rather than work in a corporate or own a business?
I think it just depends. It depends on your personality. So great question, but I can't answer that. It depends on your personality.
Okay.
All right.
Yep. All right. That's it for today. Thank you so much for.
Okay. I appreciate it.
having
Okay.
us. Yeah.
Take care.
And yeah, the quiz link will be out later today, I believe. Someone else will make it later on, so stay tuned for that. And thank you everybody for coming in today as well, and have a great day.